All right, let's talk about Malaysia's healthcare system. There's a huge overhaul in the works, all based on a document called the Health White Paper. But what does all that policy speak actually mean for you and your family? Well, today, we're going to break it all down and look at the blueprint for how your care could completely change.
I want you to just think about this for a second. What if your healthcare was actually built to know you, to anticipate your needs, and to put you, the individual, right at the very center of everything? That's the big idea we're exploring today, this shift to a system that's truly all about you.
So how is this massive change supposed to happen? Well, the blueprint lays out 5 key strategies. First, we'll look at a fundamental shift in where your healthcare journey actually begins. Then we'll see how the entire system is going to get smarter and more connected. After that, we'll dive into the digital tools designed to put you in control. And finally, we'll cover the promise to make sure no one gets left behind. Okay, let's kick things off with the very first part of this blueprint. This is all about transforming how healthcare is delivered to you. You can think of this as the how-to guide for the whole plan, the new structures that are designed to change the system from the ground up. It's about every single interaction you have with a doctor or a clinic. The first, and maybe the biggest change, is about shifting the center of gravity in our healthcare system. For years, everything has been really hospital-focused, right? And what does that lead to? Overcrowding and long waits. This new plan flips that completely on its head. It wants to make your local clinic, what they call primary healthcare, your first and most important stop for staying healthy. Now, this isn't just about giving clinics a new coat of paint. It's a whole new model built around something called primary healthcare teams. Just think of it like your own personal health crew, a dedicated team of doctors, nurses, and pharmacists who aren't just there to treat you when you're sick, but to actually keep you and your community healthy in the long run. So, what would this actually feel like? Well, first, you'd enroll with a local clinic that you choose. And this isn't just filling out a form, it's the beginning of a real relationship. From there, that dedicated team works with you over time, getting to know your health history inside and out. And what if you need to see a specialist? No more starting from scratch. Your team handles the referral and shares your records seamlessly. See, it's a move away from just one-off visits to continuous, proactive care. Okay, so if local clinics are stepping up to be the first line of defense, what does that mean for hospitals? Well, it means the whole system has to get smarter. And that brings us to the next strategy: optimizing hospitals and building real, effective partnerships between the public and private sectors. This slide really shows the difference. On one side, you've got the old way, overcrowded public hospitals trying to handle pretty much everything, which leads to those endless waiting times. But on the other side, you have the goal, a balanced system. This is where hospitals can finally focus on what they do best, serious, complex cases, while public and private clinics work together to handle the rest. It's all about creating a more efficient, collaborative system that works better for everyone. Now, you can't have a smart, connected system like that running on paper and fax machines, right? It needs a digital backbone. And that brings us to the next big piece of the puzzle: using technology to put you, the patient, right in the driver's seat of your own health journey. And this right here, this is the dream. Imagine it, your entire health history, every checkup, every prescription, every lab result, all secure, all in one place. A single record that travels with you, no matter which doctor or hospital you go to. That's the promise of what they're calling the electronic lifetime health record. So let's quickly unpack these tools. The electronic medical records and the lifetime health record mean you never have to tell your whole life story to a new doctor again. Telehealth and virtual consultations mean you could get checkups from home, saving you time and travel. And digital appointment scheduling, well, that just makes life easier. It's all about making healthcare work for you, not the other way around. Of course, whenever we talk about digital health records, the big question is always privacy. Who owns all this data? Well, the white paper is crystal clear on this point, and it's absolutely crucial. You. The whole system is built on the idea that you own your data. You're the one who grants access, which puts you firmly in control. Look, a smarter, more efficient system is great, but it's pretty much meaningless if it doesn't serve everyone. And that brings us to the final, and you could argue, the most important strategy of this whole transformation: ensuring equity. This is the moral foundation, the promise that this new system will not leave anyone behind. And this isn't just some vague promise. The plan specifically calls out the need to strengthen care for vulnerable groups. That means taking a hard look at policies to better serve older people, indigenous communities like the Orang Asal, persons with disabilities, and even non-citizens like migrants and refugees. It's about actively finding and tearing down the barriers that stop people from getting the care they need. At the end of the day, it all boils down to one core belief that holds this entire reform together: the idea that good health is a fundamental human right, not some privilege for only those who can afford it or easily access it. That principle is the moral anchor for this entire transformation. So, there you have it. 5 core strategies, all interconnected, designed to totally reshape your healthcare experience. It starts with a strong primary care team, which then feeds into a smarter, more connected system, which is powered by digital tools that put you in control. And all of it is built on a promise that everyone is included. This is a really ambitious 15-year plan. It's trying to shift an entire system to be more proactive, more integrated, and more focused on the person. The blueprint is here. So the question that's left isn't just about whether it can be done, but what it could mean for the health of an entire nation. Is this the future of healthcare? We'll have to wait and see. Thanks for joining me.